We're on.
Okay.
Good morning.
Good morning.
Welcome to Doc Talk Live. Let's see what this says. Try another way of going live during your broadcast. Why would I do that? Why would I try another way of going live?
I don't know.
All right.
It seems to be live. So
Anyway, I'm with Renie Moss. Renie, thank you for doing this with me today.
Glad to be here.
Renie is the program director of the Alabama Genomic Health Initiative.
That's right.
And so, basically a couple of weeks ago, I had a friend who works in UAB who mentioned to me about a study where you go in and you get your blood drawn and they do genetic testing. They look at your DNA, but it's not like a 23andMe type thing.
Right.
Where, you find out what your heritage is and your sort of biological history, if you will, or your genetic history. This was more to find out what diseases you may be susceptible to.
That's correct.
In your life. And I'm like, this is really good information. People need to know about this. So I went in and I had my blood test. I signed up for your study.
Okay, great.
I signed up for your study. I've had my blood tested. I have not received my results yet, so hopefully we can follow up with a results type of thing. But I want you to tell our listeners about your study, and tell us about the Alabama Genomic Health Initiative.
Okay, great. Well, I think probably one of the first places to start is to say why the state of Alabama even funded this to begin with, because it's kind of unusual for a state to fund something like this. And I think the main value is that we have a very diverse state, a diverse population, and the state of Alabama believes in the value of the precision medicine initiatives that are going on here at UAB and around the state. And the Alabama Genomic Health Initiative offered an opportunity to do exactly what you're saying, to offer residents of Alabama a screening for well-known, medically actionable conditions that you may be genetically predisposed to.
So this is a free test. This is paid for. It's funded by the state of Alabama.
Correct.
So the only requisite is you have to live in this state.
That's right. 18 or older and a resident of Alabama is the only requirement to participate.
And you have to sign a consent form.
You do.
Okay.
Yes.
And so I was like, sign me up. I mean, I want to know what I'm susceptible for, because if I know in advance what I could potentially modify, then that could be very, very valuable. So give us some examples of how this could be practically useful as opposed to just sort of on paper useful.
So you hit the nail on the head in saying that there are things that you may be able to do to head something off if you know about it ahead of time. So, for example, there are several diseases on this genetic screening that are associated with cancer predispositions. A lot of people are familiar with BRCA1, BRCA2.
That would be the breast cancer.
That's correct. And a lot of people don't know those can also happen in males. And so there's some misnomers in terms of genetic predisposition for colon cancer and other things that could be associated with some of those genes. There's also a number of cardiovascular conditions that can have a genetic inheritance pattern or trait. And so knowing that ahead of time can set you up for more proactive management and preventive care style of health for you, rather than react when something comes. If you know it ahead of time, you can set up with your primary care provider and others to be able to manage that.
So as an example, I'm over 50 years old and I need a colonoscopy. And so potentially I'm more likely to get screened. I'm more likely not to put it off if I know I'm at risk. Now, the flip side could also be true, right? What if this test says, hey, you're really not at risk for colon cancer? Maybe I'm less likely to be screened. So that could be a problem too.
Right. And so we have genetic counselors on the study that are very clear, and our patient navigators are very clear that there are a lot of things that contribute to disease other than genetics. So this does not replace your preventive care that is currently medically managed. So you should still get your colonoscopy, like you said, after age 50. If you're a female, you should have your mammograms at the appropriate time. But if you find out that you may have a genetic predisposition, it may move that up for you.
Sure.
And give you a more precision care course of action to be able to monitor that earlier in life. There could be some patterns their family members may need to know as well, because some of these conditions carry a 50% chance of a first-degree relative, a child or a sibling perhaps having something. So this is a study that offers you personal information, but also it may have benefit for your family members. And so we talk about how to have those conversations about health in a trusting and meaningful way in families.
How do people sign up? How do they find you efficiently? How do they sign up for the study?
So everything is on our website, aghi.org, and there is a 1-800 number. It's an 855, which is a toll-free number you can call. There's also an online scheduling system. You can select a date and a time to enroll there. We currently have standing enrollment sites here at the Kirkland Clinic in Birmingham, at UAB Selma Family Medicine, and at UAB Medicine in Montgomery. We also have pop-up enrollment events where we're trying to reach rural areas and areas where maybe there's not a clinic set up. So we've done a number of events kind of around UAB Hospital. We did one at Baptist Health Montgomery. We're looking at going to Dothan, to Tuscaloosa, to Mobile in this year, and really try to meet people where they are and explain the value of this project to the residents of Alabama, and perhaps build some trust and understanding in genetic medicine and what it can mean for you.
So aghi.org would get us to the online schedule.
Yes.
Is that right? And do you have the 855 number by any chance?
It is 855-462-6850. And that's also very bold on the website, aghi.org. It's the first thing you see in the heading, 855-462-6850.
I wanted to get that out there up front in case people decided, hey, okay, I'm done listening. Okay, I got the
That's
idea.
Right.
How long is the study going to go for? How long has it been going, and how much longer will it go?
So the state of Alabama gave us funding in 2017. So we began enrolling in May 2017. It's intended to be a 5-year study. We hope to enroll 10,000 people over the course of 5 years. And while we're certainly giving value to individuals, another value of this is the biobank. So when you enroll, you were given the option to consent to donate a portion of your blood to a biobank that could be used for future research. You can decline that, or you can choose to opt into that. And the value of that is that this is a rich, I mentioned on the front end, that we're a diverse state. A lot of the biobanks that we have right now in medical worlds are very white, very Indo-European. And if we're going to get to the heart of some of these genetic diseases that affect our residents in Alabama, then we really need to be comparing apples to apples. So the more diverse our biobank is, then the more effective it will be for better understanding the origin of diseases and ways that we can better treat our residents here in Alabama.
Now, I grew up in Michigan, but have lived in Alabama since '94. So how does that affect, I guess, the so-called biobank?
Well, you're a resident of Alabama, so if you opted in, then your sample lives here at UAB in the Shelby building right across the street from here. Mm-hmm. And it would only be available for researchers that are approved by the UAB Institutional mm-hmm. Review Board. So there's very careful ethical management of those future research.
I opted in, but I don't know why. Excuse me. I don't know why I wouldn't opt in. Mm-hmm. Why wouldn't somebody opt in?
Well, I think some people have, there may be faith or religious reasons for
mm-hmm.
that.
Okay.
And there's understandable misgivings and trust issues with history of research, especially here in Alabama. We have a history that we have to overcome. So we are also doing some community engagement outreach. We're doing town hall meetings around the state to really inform people what this study is about and really what genetic screening can do in general and what a biobank like the AGHI Biobank could offer to families who are living here in Alabama now and really posterity for that matter. If we are able to better understand today reasons for certain cardiovascular disease, then 25 years from now we may be in a much better position to understand how to be even more proactive and preventing things that are affecting us.
Are any other states doing this?
We are one of the first states. There might have been one or two other states, but we are actually, we get calls a lot. How are y'all doing this? We're interested in doing this
So
as
who
well.
is the brainchild behind this?
The brainchild behind this really is a combination of Dr. Selwyn Vickers, who's the Dean of the School of Medicine. He was at a conference understanding more about genetic screening and biobanks and what this can offer. And I think he talks about a light bulb went off in his head, and he called Dr. Bruce Korf, who's our Chief Genomics Officer, and said, what do you think? Could we do this?
That's
and the rest is history, and that's really how it came to
That's
about.
awesome. I'm going to give that number one more time, 855-462-6850. And again, go to aghi.org. Renie, do you have anything else to add? I mean, I think we sort of hit what people need to know in a very brief period.
I think we did. I think the important thing to be completely transparent is only 1 to 3% of people are going to be found to have something. Even if your result is negative, our genetic counselors are looking over the family history that you provided. If they see something in that family history that maybe warrants more clinical diagnostic, they're going to make that recommendation in the letter. They'll say, your results were negative, but there's a lot of things that contribute to disease. You shared with us that, and it'll have that. And based on that, they may say, you may benefit from further consultation. And they have their personal number at the bottom of that letter for you to follow up with. So there's a relationship that we really hope to build with you and your health, which is where the precision piece comes in, so that you have more information to own your health and manage it in the future.
Perfect. Thank you, Renie.
Thank you for being here.
I appreciate it.
Appreciate it. Thank you.
Thanks, y'all. Finish.